I remember seeing patients that would come in having done keto or low carb, and they lost all this weight. But then I looked at their cholesterol profile and I was like, oh God, what happened?
Healthcare system isn't about health, wellness, and longevity. It's crisis intervention and revenue generation. Lee and I came together with this passion for better nutrition, proper exercise, the importance of sleep, and community engagement.
Welcome to the Kurisko & Company podcast. I'm your host, Lee Kurisko, MD. Today, our guest is Suzzanah Bozzone, a medical doctor. She is board certified in both family practice and lifestyle medicine and is fluent in both Spanish and English. She has worked in both private and community clinics in Colorado, California, and Tennessee. She has worked as medical director at Sonoma Valley Hospital. Today, she works passionately to create employee wellness programs and community programs that inspire and empower people toward more vibrant and purpose-driven living. She believes that healthcare should be about a purpose-driven identity rather than a diagnosis code, offering power through disease-fighting lifestyle rather than medical dependence. She has a passion for compassionately addressing the root of healthcare problems and striving to empower patients without criticism to find joy in the journey towards their best selves. Well, Dr. Bozzone, thank you for being here.
Yeah, so happy to be here. Thanks for having me.
Your profile at Love.Life is very inspiring. In the last few years, I've become very motivated. I'm a diagnostic radiologist. I look at CAT scans. And back in 2017, I read Dr. Greger's book about how not to die. And I came to realize that really what I do as a diagnostic radiologist is sit there and diagnose lifestyle diseases. Yeah. And it wouldn't be uncommon actually to, diagnose half a dozen lifestyle diseases on a single scan. People have coronary plaque, fatty liver, gallstones, diverticular disease, osteoporosis, et cetera. And it wouldn't be uncommon to see that in a single scan. And yet in my role as a radiologist, looking at patients' charts, from time to time and learning about them, really the lifestyle element is really not addressed in any meaningful way. Yeah. And so that's what's motivated Joyce and I, to create this channel and our website and so on to try to empower people. But I'm curious to know, how did you get into this whole thing?
Yeah. I love it. And I love hearing other people's stories because it is amazing. And one of my favorite things is to watch new attendees at the Lifestyle Medicine Conference or the Plant Nutrition Conference that are coming for the first time to hear this information, new physicians especially, because we're just not exposed to it, despite how healthy we might perceive our lives to be. And that was my background. I really thought I was pretty health conscious. I'd always been an athlete. I was on a swimming scholarship in college. And then yoga was my sanity throughout residency. So I really felt, kind of fit because of movement. Right. And then people would come to me and expect me to be vegetarian in the clinic because they knew I was a yoga teacher. And because those two things happen to seem to go together. And I would say things like, no, we have these teeth to eat meat, Yeah. And no one seemed to know that physicians are not given any medical training in nutrition, certainly not food as medicine, right? We're just taught what is scurvy or these things we've never seen, but we never really, address what we do 3 times a day, every day, most of us, and how it might fight disease or feed it. And so the way that I came to it was really, so after I was in residency and then moved to California and was still very involved in yoga, but I was working as this medical director of wellness, and so that was basically the bridge between the small hospital in Sonoma and the community. And so I worked with people it was really more exercise as medicine, but doing employee health programs and trying to make evidence-based programs that addressed health from the community. So especially out of a gym and creating partnerships because the leadership in that hospital recognized that it was sick care, and that we really need to get the community to support and be part of that and to make the hospital not just be where you go to be sick and die, but rather to have an influence in health and vitality. And so So that was kind of my role. And in that, I met someone who asked me, had I ever heard of lifestyle medicine? And I was like, no. And he said, well, there's a conference, and it was within like 2 weeks, and it was in San Diego. And I was like, oh, I've never been to San Diego. Okay. So I ended up working it out so I could go. And again, it was just that. It was walking in to hear, oh my gosh, these are the things that I wanted to tell people. I remember seeing patients that would come in having done keto or low carb, and they lost all this weight. But then I looked at their cholesterol profile and I was like, oh God, what happened? But I didn't know that saturated fat is the primary driver of LDL cholesterol. I didn't know that it was so much what they ate. That's 80% of what's driving their vascular disease, our top killer, and that this was the focus of all of the medicines we were given. Oh, you're over 40 and you're a diabetic, so automatically you need a statin. And if you don't give them a statin, then you get a letter from your insurance company saying, why didn't you give this patient a statin? But no one tells us why their cholesterol is high. And what they're eating and how we could use food to improve their cholesterol. So it just gave so much power. And I felt a little bit, number one, like, these are my people. All these people seemed so energetic that, the lifestyle medicine people had already been on a run, and they were looking vibrant, and they were there, and they, were eating plants, and it was just amazing. But number two, I felt kind of gypped that I am just hearing of this now. I've been in practice for so long. I had good training as far as, the rankings and all those things. But how is it that I have never heard this before? And if I hadn't heard it, then that means that there are so many people and physicians that are guiding care for people that hadn't heard this information. So that was just the beginning.
Yeah, I mean, way back when I finished med school, I did a family medicine residency. I worked as a family medicine doctor for 3 years.
Wow.
Radiology. And one of the things that motivated me at that time was I was interested in actually making people healthy. And I got frustrated because I felt like I really wasn't making people healthy.
Yeah.
And that I was just putting Band-Aids on issues. So I mean, there were some other reasons as well, but I decided to sort of focus on the diagnostic side of healthcare. And I actually really do enjoy radiology. I think it's a great field. So I went along for many years, and I read Dr. Greger's book, and I was just shocked. And I was a bit skeptical. I read Dr. Greger's book, and then I read Dr. McDougall's The Starch Solution. And I was like really incredulous, because I had thought that low carb was the way to go. And that's sort of been what I've been doing for years. Yeah. But I was actually pre-diabetic. I had sugars creeping up, fasting sugars creeping up above 100. My cholesterol was 330, and I was just in a state of denial about it, largely because my dad had inclusion body myositis, which might have been triggered by taking statins, and it subsequently caused its demise. So I just sort of put the high cholesterol thing, I just kind of denied it. But then when I realized there was something you could actually do about it, I tried it, like I say, with some skepticism. And within 3 or 4 days, my blood sugar was completely normal. Like, I actually took a picture of the glucometer because my sugar was 65. And I felt fine. I wasn't feeling hypoglycemic. I felt totally fine, and it stayed down. And my hemoglobin A1C now, runs 4.7. It's just perfect, And then I had my cholesterol checked, and it had dropped 187 points.
Wow.
No meds. And, my exercise capacity had improved, and some minor health issues, that just really minor things, like a bit of reflux and a bit of acne rosacea, just little things that you just kind of put up. They just went away.
Yeah.
It just went away. And so I was just sold on this thing, and have continued to learn more and more, but I also sort of want to give back and, try to educate people. But, it's interesting. Just 6 months ago, I started this new job in Iowa. I'd been working in the Minneapolis area for over 20 years. And one thing that gives me a lot of hope is in the small hospital I work at now, there's 2 physicians that actually 3. There's 3 physicians that have interest in plant-based medicine.
Wow.
2 of them are primary care doctors, and one of them himself has lost a ton of weight. Like, he's not 100% plant-based, but he's really moving in that direction, and it's like gets it to how important it is. The other one is, pretty much 100% plant-based. And so myself and one of the other doctors in Joyce are going to be doing a little 3-part series on plant-based eating. I
I
mean,
love it.
here we are like in rural Iowa. Who would have thought that there'd be interest, you know?
Yeah.
And when I started this almost 7 years ago, it was really kind of a fringy thing. Uh, so, so I've, we've been really motivated and excited about the whole thing. So now what kind of success stories are you getting in your practice? Like what kind of illnesses are improving when you're,
Oh, it's so powerful to see, some of my favorite, well, I saw two women yesterday. One of them they both went, some mother-daughter, and they've both been on this whole food plant-based journey for about 6 months. And the mother had lost 33 pounds. The daughter had lost, I think she was at 16 pounds. She had, and she's 2 pounds from her goal weight. And
wow.
so just, in that journey, feeling, I think that what's more important than the weight, because we don't want to focus on these numbers. And that's kind of something that I try to get patients away from. I mean, it's great to talk about that, but I think what's really the value is that they feel better. They're more vibrant. They're more energetic. They don't have to take a nap in the day anymore. These things that are really impacting our quality of life and our vitality. And that's the stuff that while, you look at weight, and then some people drop weight faster than others, but it is a kind of a skewed number because we're not talking about body composition. Well, now they've got enough energy and they're feeling better and motivated, and they want to grow on this. So they're going to start resistance training, and that changes your weight in a way that the scale doesn't reflect. But I think it's so important to recognize how people that find power in this journey are more connected to what matters most to them. They're more connected to their purpose. They have the energy to do what matters most to them. It's contagious. It's fun, and they're finding joy from it. And now that's not everybody, right? And there's a whole group of people, but I think it's not just about the weight loss or the medication reduction, which I see a lot of. Let's see. I mean, and it's really powerful to just see how people can engage more in what matters most to them. And that's really where I get my biggest kicks is seeing how they switch their life on, and sometimes that requires a diagnosis that you don't want to see. But of course, weight loss, I've seen just amazing cholesterol reductions that are just out of sight, and A1Cs, where people come in. I just saw a woman the other day who had just been diagnosed with diabetes. And just within, her labs were 3 months apart. And in that 3 months, she went plant-based. She went from diabetic, so her A1C was 6.5, to an A1C of, I think it was 5.3 in just that 3 months, and it's incredible, right? Because you go from just losing the diagnosis of diabetes, but then you also lose the indications for all the medications that go with the diagnosis of diabetes, because it's automatic. It's equivalent of, well, you have diabetes. Well, we're going to treat you like you have heart disease too, because that's what we're most concerned about. And so as a result, then you get a statin. You're usually going to get a blood pressure medicine to protect your kidneys. You're all of these things that go together with that. And it's one diet that treats them all. And not only that, the diet gives you vitality, not just a reduction of diagnoses or medications.
Well, one of the things I find really compelling about the whole plant-based approach is that, really it's about health. And oh, by the way, you're going to lose your excess weight. Whereas most other approaches, it's all about the weight.
Yeah.
And, like in things like keto, it's, the negative consequences are kind of just pushed on the back burner. So the real focus is on, just being healthy.
Right.
So now when you, how do you encourage people to do this? Do you encourage them to do it sort of in a stepwise manner, gradually, or do you have them just jump in the pool and just completely switch over?
I think it depends on the person. I think it always depends on the person. The number one thing that I kind of go, how I approach the patient is to first ask them why they're here, what matters most to them in their life. Purpose-driven living, I think it should be in the forefront of, well, it's not, it really should be the question we're asking, why are you here? And then from there, then I ask them, okay, well, so I know that you came in because of your XYZ diagnosis, right? That usually brings them in the door, but that's not why you're here. And that's not how we're going to measure your success, because that doesn't define you, and it doesn't create value or a lack thereof if we get you off of meds, or if we, improve your A1C or your blood pressure or whatever. But so first kind of getting those big questions, and then I kind of say, all right, well, what are you ready to do? And a lot of times they come in knowing why, why they're there and what they're ready to do. And so then if that's the case, then I'll start with what they're already ready to do. If they don't know, then I'll say, all right, well, based on, the best evidence that we have with lifestyle medicine and your diagnoses and your picture, these would be my recommendations. Now, what are you ready to do? Because it still might not be, you're going to do all of these things that I say, but I just kind of ask them because I used to go about it a lot more intensely. And then what I found was a lot of people, I was adding stress to them. And if I'm adding stress to them, I'm not helping them, because if I'm overwhelming them by the food they're going to eat, then they're not going to stay with it very long. But also they're not going to receive the nutrients, even if they try to, because they're in this stress response. And so, what I generally do for if they are, okay, I'm ready, tell me what to do in order to get me a healthier diet. Then I have a stepwise approach that it's basically 3 steps, but each step is, 4 to 5 steps. And I called it Feed Your Flora. And I say, okay, you can take this as slow or gung ho, and they're already like halfway there, and they just do the whole thing. And that's probably less than 10%. And the others are like, all right, I can do step 1 or the first 3 parts of step 1. And I'll start with ground flat. I start with water and treating constipation first, because before we add a bunch of fiber, if you're not pooping, you're going to hate me. You're not going to do very well. You're going to have a lot more bloating and so on. So really asking them if they're constipated and making sure they're eliminating effectively. We work with that first. Then water and ground flax is where I start first. And I start with dark leafy greens, because they're so cleansing on the liver and they're so nutrient dense. And most people, even if they're already, quote, plant-based or vegan, are not eating enough dark leafy greens. And I find that almost consistently, unless they've already done Esselstyn's program or for some, unless they're like already have been exposed to something. But dark leafy greens are just a low-lying fruit, and then increasing that. And then if they have gut issues, then I might, I do beans and legumes first, and I might leave the grains a little bit later, just depending on, because a lot of people have trouble tolerating that. So I do it kind of stepwise based on what people mostly tolerate best if it's new to them as they build their fiber, and just give them a little caveat that's like, well, most people can tolerate pretty easy 5-gram incremental fiber increases. But if you get real bloated or you're miserable, it's not going to kill you, but you might want to just back down and go more slowly and take it at your own pace. If you're constipated, which sometimes happens when we really boost that fiber up, then make sure you're drinking water, make sure you're moving, make sure, we work on that, maybe get a squatty potty, maybe, and it kind of back up before we start really moving forward. And so that's really just like their tester. And then we go as far as they want to go to get the results that they want to see. And then it's fun, because as you first get them nourished, then start adding in, well, when are you eating? Why are you eating? Where are you eating? All of the things around that, so they can really receive the nutrients. How are you eating? Are you distracted, or are you stressed out at work? And so all of those things to really say, okay, well, now it's a bit of refining. So first get the nutrients on the plate, and now let's look around those nutrients and how can you best receive what you're working so hard to get.
The green leafies are amazing, actually. I'd been on the plant-based thing for a while, and I was reading Rip Esselstyn was advocating green leafies, and I didn't really like them, but I said, well, what I'll do is I'll start having a serving in the evening before my main meal when I'm hungry. And so like I ate that as the first thing, and I just kept doing it. And then it's like you start to like it. Yeah. So I got pretty good about having like a pretty good serving of green leafies, for the last several years now. But then I had a conversation with Dr. Brooke Golder. She was on the podcast, and she's like a real advocate of getting like the raw kale or whatever greens, put them in a smoothie. And we've got a bumper crop of kale this year in our garden. So almost every morning I've been having like a big blender full of a kale-based smoothie. And as you probably know, like she's big on the whole autoimmune thing. Well, my health has been good, but I've had this little bit of plaque psoriasis on my elbows that had been there for decades. It didn't bother me. And I did the green smoothie thing for a few weeks and it just went away.
Wow.
Yeah.
Yeah, cool.
I mean, the thing is with the whole plant-based thing, when you start really dialing it in right, like people don't get how incredibly powerful this is.
Oh yeah.
But sometimes with some programs, like keto or whatever, people will get improvements in the short term, as like they may lose weight or whatever, and they may feel better and they have less bloating. But I sort of see it as short-term gain for long-term pain. Because you're disrupting your microbiome, you're increasing your risk for cardiovascular disease. What are your thoughts on that whole craze towards, the carnivore diet?
Oh man. Oh, it's totally nuts. But the thing is that it's very appealing for so many, right? Because people like eating meat. They like they certainly like eating cream, and all these very, and actually I had a patient there's so much draw, and it blows my mind, the people that get these incredible, huge amount of followers online and the messages that they're sending that are completely discordant with what our evidence shows. But yet it's tragic. And it just makes me crazy because, sometimes I get sent this information. I get patients that understandably are confused because they're like, well, this guy has like a gazillion followers and he's saying that you could do this, and they'll take a little tiny bit of truth. And so just something I was honestly just talking with this cardiologist about just recently, because a patient had asked me about the coronary artery calcium score, right? So this is a scan that we do if people are an intermediate risk. So their cholesterol might be high or they've got some risk factors, but they're not very clear, like you are high risk and you definitely need a statin. They're in this kind of gray area. So we do this scan and if it's positive, it would show calcification on your coronaries. And then that would suggest that maybe we should be more aggressive with your treatment, maybe start a statin and so on, right? And so apparently there's somebody that's saying, well, you should eat low carb to address and reverse these coronary artery calcium scores that's out there. And he's got all these followers but just had to like break it down and say, well, wait a second. First of all, the endpoint that we want is reduced death and reduced disease, not reversed coronary artery calcium scores. And so we have to first kind of say, what is he claiming? And even if it is or is not true, let's look at the endpoint he's looking at. Okay, well, so if that's the endpoint, and then he's saying, all right, we want to really flatten out your insulin and reduce your carbohydrate intake so that your body's not having these insulin spikes to bring in your carbohydrates. And that's one piece of a vast cardiovascular profile. So we have to, but totally disregarding the fact that that we can really improve insulin resistance with a whole food plant-based diet, but what we can also do with that we cannot do with a low carb diet is reduce your LDL. It's reduce inflammation consistently. It's really looking at all of how do we optimize our heart health and reduce inflammation and reduce progression of plaques and all this development of heart disease. It's not just that one piece, but this person is like saying, okay, I'm going to take this one little tiny tree in this forest of heart disease, and I'm going to focus on one little endpoint that's not death or heart disease or heart attacks or strokes or any of that, but it's a scan and that scan is something that we don't follow. We don't follow repeat coronary artery calcium scores because they're talking about, what is hardened, in terms of the plaque, as opposed to the soft plaque. That's the dangerous plaque that you can't even see there. So the endpoint that he's referring to is not even an endpoint that we look at. And so now I can't even remember the question, but it just got me so riled up because I thought, gosh, this guy, there's so much false information out there. Oh yeah, we're talking about carnivore and low carb diets. And what I see when I see patients, and I'd say most of my patients have at least dabbled in that at some point in their life. And first we have to reset their gut, because there's no greater way to destroy your gut microbiome than removing all the fiber from it. It's just, I don't know that let me back up. Not everybody has dabbled in carnivore, but most everybody has dabbled in low carb, certainly. And so resetting the gut to again be able to use those carbohydrates and making sure that the carbohydrates we're eating are health promoting carbohydrates, but we require a healthy microbiome to utilize that fuel. And if we've been on a low carb diet, our microbiome is not set up to do that. So just being patient and holding their hands and saying, we want to get you the outcomes that you want, because what do I see most of the time is that they did really well at the beginning. Often they lost a lot of weight. And then by 6 months, there's no more results. Their cholesterol's high. They're really dealing with all the results of skewing our microbiome in a negative way. And also, they miss eating, and they long for. I've had patients that really want to eat delicious fruits and vegetables, but now their gut can't handle it, and now they're so confused and they're not getting the results, and they're just like, oh my God, is this forever? I don't know have you found that similar?
Yeah, well, and exactly as you say, you destroy your ability to cope with the higher fiber foods. Then you get gut upset, and then you think, oh, that the primary problem were those vegetables. I mean, a big source of confusion that I suffered was, my sugar tended to be a little bit high. It was true that if I did have carbohydrates, the sugar would tend to go high. If I restrained my carbohydrates, it would drop. But what people don't understand is that the driver of insulin resistance, which is what causes high blood sugar, is primarily the saturated fat in your cells. And if you can get that saturated fat out of your diet, start clearing the cells, your insulin sensitivity improves. And this is just totally counterintuitive. Like, I've had conversations with people that I work with. They cannot wrap their head around the idea that you'll improve your blood sugars by eating more carbohydrates. Right. I mean, I was so skeptical myself, but I said, okay, I'm going to give this a try. I'm going to suspend my disbelief. I'm going to eat, fruits, vegetables, whole grains, legumes, and that sort of thing, for a week or so, and just see what happens. And my blood sugar just plummeted. I mean, it stayed, was in the bottom of the normal range, right? Exactly where you want it, which is where the lowest cardiovascular risk is, if you can keep it in the bottom end of the normal range. But people just can't wrap their head around it. And so what happens is they're insulin resistant. They eat a high carb meal. The blood sugar bumps up. They say the carbs are the problem. Well, the reason the blood sugar bumped up so high is because you're in a state of insulin resistance. Mm-hmm. Blood sugar might actually run a little bit high initially because you're insulin resistant, but once you clear that insulin resistance, it's going to come down. Would you agree with that statement?
Absolutely. Absolutely. Yeah. And that's it. And so many people are so confused because this message that carb is a 4-letter word, that everything carb is so bad, but yet, and it drives me crazy because I see, really smart providers and very smart people still saying, eat a low carb diet, but they're not talking about food. They're talking about a carb, which is a macronutrient, and that we have to recognize that the carbohydrates that we need to eat, that we require to eat to fight disease and to have a healthy gut and to have a healthy microbiome, are these whole plants in diversity. And they will automatically, with the exception of palm oil and coconut oil, if we're eating whole plant foods, we will be low in saturated fat. Will not only remove that saturated fat that's driving the insulin resistance, but we're also improving the fiber, which is stabilizing the sugars as well. So we're not having these huge spikes and dips. And it does take a minute, because while you still have the fat in your cells, then every time you eat a carbohydrate, especially refined carbohydrate, but sometimes even like oats, right? And it's a good food, but for people that are still struggling with insulin resistance, it might shoot them up, and then they start doubting. But we have to recognize we've got to clear that fat out. We've got to increase the fiber so that our sugar doesn't spike up, so our insulin doesn't spike up and crash us down 2 hours later. And then we're dealing with, is it anxiety? Is it low sugars? Or what are these symptoms? And so that stabilization process does certainly take time, but absolutely right. So getting that saturated fat out and recognizing also that processed foods will absolutely drive that as well. So as much as we can replace processed foods, whether they're vegan or whatever they are, with whole fiber rich, nutrient rich plant foods, and it just makes so much sense. And you know it when you eat it, because you're like, this is what my body needs. This is what my body craves to feel nourished. And it's a real shame how much false information is out there, and how the whole world of carbohydrates has been demonized, when the vast majority of our healthiest foods and disease-fighting foods fall into carbohydrate macronutrient category.
As Dr. Greger says, jelly beans and kidney beans are completely different.
Yes, right on.
And people sort of conflate them as all being bad. One of my big concerns when I started the plant-based thing, like so many people, is the protein, right? I had this thing in my head that one time I was almost like a professional level bodybuilder many years ago. And then, I got really busy with my medical education. That was actually way more important to me. But I had this thing in my head that I had to eat meat 5-6 times a day, or I'm going to just wither away. But it's just so untrue. Anyways, what are your thoughts on that?
Yeah, on getting enough protein in a plant-based diet. Well, and it's so true. I mean, when I was a swimmer, and nothing like a bodybuilder, which is, it's in that class of people, and those real gym rats, it's so true. And again, I have so many patients that get their nutrition advice from their trainer, not from their doctor, because their doctor doesn't have time or really the knowledge base to talk about it. And a lot of people kind of are aware of that. So they get it from their trainer. And so often it's protein, 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 protein. And I do think that we've understated the amount of protein that we need in the whole food plant-based diet. However, it's very easy to do it without supplementing protein. I don't have any protein powders or any of that stuff. And I exercise, I should exercise less. However, certainly build muscle and do weights and do resistance and exercise an hour on most days, if not more. And so with all that in mind, I do it very easily, getting sufficient protein, and I've calculated it. And I think we have to be conscious about it, particularly certain people do better than others. I think that women, kind of perimenopausal, postmenopausal women, I find need to be a little bit more conscious about it. As a gross generalization, they're not thinking so much about protein more, but where does it need to come from? And also to recognize that it's not protein, it's a package, right? Because protein comes in a package. And if the package is, say, a grass-fed and finished meat of some kind, you have to recognize what else is in that package, right? Iron, you don't have any fiber, you've got a lot of inflammatory things, you've got saturated fat, you've got other things that grow, basically IGF-1, all of these pieces of this, that again, it's not just one thing, it's the package, what is being served in that package. And we know that the more of more red meat and the more processed meat, for example, that you get, the more chronic disease that you get. But the more plant-based protein that you get, and where is plant-based protein? Well, it's in everything. Right. And to remember that yes, broccoli has protein, that everything has protein, but we do want to be conscious to make sure that we're getting beans, and, or yes, soy. Yes. It's one of my favorite things. I just had actually the most delicious tofu scramble, and put in some of that tempeh, that like smoky tempeh stuff inside. And it was with a bunch of vegetables, and it was the most deliciously amazing treat. But all that to say that we want to be conscious that we're getting our beans, our soy, our whole grains, right? Because we've got to get the lysine, we've got to get the methionine, we've got it, though every plant has all of your essential amino acids, we want to be conscious of those that might be less. For example, we want the methionine that's in the whole grains, we want the lysine that's in the beans. We want to make sure that those are represented. They don't have to be at the same meal, but they do need to be there. And for those of us who are really trying to build muscle, we might have to add more hemp hearts. We might have to add more protein sources, or be more conscious of it, some branch chain amino acids. I do a video on this actually because it's talked about so much that, yes, you can get it on a plant-based diet. You might have to be a little bit more intentional if you're one of these people that are really exercising to an extreme amount. But the vast majority of people will get their protein easily. And it might need to be add a little bit of more conscious, intentional whole protein choices like soy or hemp or some of my favorites if you're trying to really build muscle, which we should all be trying to do.
Yeah, I've started to change my workouts in the last 2 or 3 months to more of a strength-based type of a program. And I don't really count protein grams or anything, but I do eat a mix of, whole grains and beans. So I'm getting a variety of foods. And in the last 2 or 3 months, it's like the scale's been going up like alarmingly fast. And Joyce is there. You don't have to worry because you're building muscle, like it's like rapidly building muscle.
Yeah.
And my strength is going up like constantly. And that's without really paying attention at all to how much protein I'm taking in, at all. But like I say, we eat beans every day, eat whole grains every day. So I must be getting it. I must be getting enough.
Yeah. And then think about it in the context of if you are an athlete or you're trying to build these muscles and you're eating a whole food plant-based diet, then your levels of inflammation are lower. So your risk for injury is lower. So, and if you think about that in the context of the person that's eating a lot of meat to get their protein to build muscle, they're creating a very acidic, inflammatory environment, and they're creating an environment that's going to be more predisposed to injury. And think of how much injury has set so many of us back in our exercise or physical goals. And again, in the context, the whole landscape of chronic disease prevention is it centers on reducing inflammation and optimizing blood flow. And there's just no question about which nutritional plan does that best. We have such clear evidence to show that whole food plant-based nutrition does both of those things. Whereas you might find some paleo or some low carb things that do some of those things, but to have a nutrition plan that does all of those things is just spectacular. And we always want to put it back in that context, because again, the goal is not necessarily, to do one thing. The goal is to live a vital life and to have health as the end point. And in that process and in that journey, we reduce our risk for all of our chronic diseases, and we can build muscle at the same time. So it's pretty cool.
Yeah, well, actually, when I started the plant-based thing, the thing I noticed the most is right away. Well, I lost weight, and yet I was pretty lean anyway, but I got leaner, and I found that the increase in my endurance was just like spectacular. I mean, it was just incredible. And one time I tested myself. I use this indoor biking program called Zwift. I don't know if you ever heard of it, but
I've heard of it. I don't know what it is though.
You hook it up to your laptop, and there's a little icon. It's sort of like this real-time cycling. You can see your little icon, and you go up and down hills. It's very realistic.
Yeah, cool.
And like the resistance increases when you go up a hill and decreases when you go down a hill and stuff. And so, anyways, I use that a lot, particularly in the winter. And then I hook it up to my widescreen TV, and it's really cool. But anyways, I was curious to see if I could go 100 miles. So one day, I went 102 miles in like 6 hours and 15 minutes. And I hadn't been doing like massive training for it, and I attribute that entirely to the plant-based diet.
Yeah.
And even though I lost some weight at the time, I did not lose any strength.
Yeah.
Which was, so pound per pound, I actually got, stronger. So I was totally sold on it. But if you get way out in the weeds on this stuff, like I talked about this a bit with Dr. Furman, like you mentioned the branched chain amino acids. Do you actually recommend that people supplement them if they're weight training?
No, I don't. I mean, if they can't get it, but again, you just look at where your sources are. So oats and I kind of get, seitan. There's a lot of really great sources that you just make sure that you're consciously involving those in your nutrition plan. And that's the way I like to do most everything. I don't take any protein supplements. I don't, I'm not necessarily, I have patients, and again, I meet them where they are. So if they are really trying to, and this is a really small subset, these very kind of athletic, these are my endpoint goals. I'm trying to lift, I'm trying to gain muscle. in that small subset where if it's just easier for them to get a little bit of protein supplementation, sometimes that they do that. I don't necessarily recommend that, but but they'll usually come to me and be like, well, and I just look and make sure I understand everything in the ingredients. It doesn't have any artificial sugars, and that, and ideally I'm not a whey fan or a dairy fan, or, trying to keep it in the plant-based world. And if they want to use that, as long as it looks pretty clean, I'm not opposed to that. If that's for them, the way that they can get it, and they feel like for some reason hemp hearts or other things that are, to me, more whole food based, for some reason doesn't work for them. But I'm not one to generally recommend it.
Yeah, my reservation is, branched chain amino acids have been shown to increase insulin resistance. So I'm not in favor of sort of taking a supplement. I think, like you, that it's probably best to just get it from your food.
Yeah. And I think, in a similar vein, different topic, but with like soy supplements, I get the soy from the whole edamame, from the tofu, from the tempeh, but not from a highly processed, refined soy supplement that I see a lot. And especially when a lot of the patients that come to lifestyle medicine providers have seen or have dabbled in functional medicine. And I see a lot of functional docs, but also well-intended docs that kind of get into the supplement world, and we're replacing the real food with this like isolated version of the truth that doesn't work the way our body understands things, which is kind of in the whole context of say edamame, or this is such a complete, wonderful protein source that works really well. It also has fiber. It has what we need to use it. And I really try to avoid those supplements that take it down to a refined, powdered version of what was once a food. And then of course, if you have the fiber with it, and we know, for example, in that sense that's going to help fight your insulin resistance. It's going to help stabilize your sugar if it's in that whole world. So absolutely, when possible, try to get it from whole food wherever you can.
Now, I use soy milk in my coffee every day, and sometimes I put it on my oatmeal. Do you consider that like a refined form of soy? Do you think it's okay, or?
No, I don't. I use soy milk in my coffee all the time. Unsweetened organic soy milk is my favorite. It's the highest protein milk that you can find. I think as long as you have a clean version of it, just with every plant-based milk that you're getting, you always want to look and see what are the weird things that might be in there if you can avoid those. But I think that's a very reasonable, minimally processed version. So I kind of draw the line at, so I eat edamame, which is kind of the whole soybean, and then tempeh, which is a fermented soybean, and tofu and soy milk. And after that, I don't do any soy dogs or soy. There's a lot of soy protein isolate items out there that are sold in the vegan world, and I try to steer away from those as much as possible.
What do you tell women that are concerned about, breast cancer risk, or men that are fear being feminized by soy? What do you tell these people?
Yes, I say, do not fear. We have so much evidence out there. And even our major organizations are now realizing, even though I know for a fact there is still a doctor in my area that is telling women not to have soy, which makes me crazy. But we see reduced risk of recurrent breast cancer in people with a history of even estrogen receptor positive breast cancer. We see, you look at the kind of gross observational studies, the healthiest, longest living women population in the world is Okinawa, Japan. They live on average 8 years longer than American women, and they eat more soy in their lowest soy consumers than our highest soy consumers, and they're not dying of breast cancer. So just to recognize that that's true, and also to recognize that a lot of those claims came from studies that weren't applicable to the general population. They were either on rodents who process soy differently than humans do, or I think there was one case study of a man that just drank ridiculous amounts of soy milk that would certainly have clouded out the ability to eat anything else normal, but nobody's, so if you're eating a balanced whole food plant-based diet, and we see that if you consume soy, It's beneficial for kidneys. It might be the best protein source for kidney, which is so pivotal in reducing heart disease risk and blood pressure, et cetera, but also has really great, all the trends of the evidence suggest benefit in terms of reduction of breast cancer risk, which is where we get kind of the biggest questions and concerns on that. So I say eat it. And then I kind of refer them to Breast, the Owner's Manual by Christy, which is a great resource that goes through a lot of the data on that.
Yeah, that's a really good book. I did not know that about soy specifically with kidney function. I knew that plant-based proteins in general were, good for kidney function and help fight off that age-related decline that we see so commonly. And I believe also that there's some evidence that it helps prevent prostate cancer.
Mm-hmm. Yeah, there certainly does seem to be evidence. And when we look at that, and I'm trying to think, that data is kind of foggy in my head. I think I've seen a 32% reduction in recurrent breast cancer in estrogen receptor positive women. I think the trends in prostate cancer, if I remember, I can't remember the data on that, but certainly benefit, it trends towards benefit. I don't know how highly powered the studies were.
Mm-hmm, mm-hmm. Well, the paradox is men will fear soy as being feminizing, but the truth is actually commercially made meat and dairy is actually feminizing, because you're getting, in dairy, you're getting all those hormones because they keep the cows pregnant.
Yeah.
And then as for conventionally produced meat, they actually give the cattle zeranol, which is a very powerful estrogen to make them grow faster and fatter.
Oh, yeah.
So of course you're eating that when you eat conventional meat. But even if you eat like so-called grass-fed organic, there's still all those issues that you alluded to, like the heme iron and saturated fat and, the carnitine, which is substrate for TMAO, which is, a risk factor for heart disease. So it still comes with a lot of baggage. Now,
and also beer, just as a side note, I think it's funny when men are very concerned about having soy, but then they're drinking 4 beers. And if you want man boobs, then beer is a great way to get them.
Right. Yeah. Well, alcohol in general, it's hard on the liver. And if your liver is having trouble, then your estrogen levels tend to go high. So drinking alcohol is actually feminizing, even though it has this macho connotation to it.
Yeah.
So when people come to see you, what are you getting from people as far as pushback from family and spouses and that type of thing? And what do you tell them? How do you get them to cope with that if it happens?
Yeah, that's a great question, because I've certainly experienced that myself for sure. And I think, so a lot of times I'll kind of go from what my personal experience is to some degree, but also to recognize that people have different family dynamics, and what works for them is going to be different and individualized. And so just trying to work out what that might be. And I think the best plan of attack is to just keep your evangelizing to a minimum. Because I think many of us that are newly on this journey, if we were, I know when I was kind of fresh into this, then I was so adamant and I wanted everybody to come along, and I felt like it was really like this evangelist, but for holidays, just get off the soapbox and do what works for you, and keep it as chill and as cool as possible, because they're not going to change based on what you say. They're going to change when they're good and ready, and when they see that it's working for you. And that, we have a very kind of outspoken Italian family, and everybody's kind of really loud and yelling over each other. And then it becomes this, it's almost like there's a little bit of fun in the argument for some people. And so we have to recognize what the dynamic is. But I think in general, a good advice is to kind of say, well, this is really working for me. I really appreciate that. And to not fall for the guilt, because, what comes along, I know with an Italian family that might not be Catholic now, but, there's some kind of like guilty Catholic roots that come in there and be like, but grandma made that for you.
Yeah.
You're not going to eat the cake, the cheesecake, that's your grandma's cheesecake, that it becomes this thing that, and you're like, oh God.
Yeah.
And so recognizing what we can do to just stand your ground, be calm about it, have some responses already in your head for the food bullies that will notoriously always be at your holiday celebration,
Mhm.
and recognize where your limits are. Personally, it's much easier for me. I find much more power knowing I'm not going to eat anything right
Mhm.
there.
Mhm.
That's way easier than it used to be, where, oh, I'll take a couple of bites of that and then you can't stop and then you feel ill. Well, to me, it's a lot easier just to draw a line and
Right.
say, that's not part of what I eat. And now it's been long enough that I've been on this that people are like, well, what are you going to eat? And then ideally I just try to come in with my kale, quinoa, edamame, salad that has a lot of nutrients in it, that if needed, I know I won't starve throughout the whole Thanksgiving celebration. And
Mhm.
that if anything, I can at least reduce the damage, because if somebody eats some of it too, so bring enough to share of
Yeah.
what you know that you can sustain on. And that's going to keep you going towards the journey towards your best self. That's not going to get you off track, because it's really hard when you gain weight around the holidays or lose sight of your goal in the holidays. It's hard to bring it back. So just don't go off track.
Yeah, for me, I sort of have a similar strategy. Like, it's just like there's foods that I eat and there's foods that I don't eat. When you have those clear lines, there's no decision fatigue.
Yeah.
Like a policy in my head when I go to work, particularly in my previous job, like people brought food in all the time. Unless it happened to be some really healthy salad or something, I just had this clear line. Like, I'm not going to tell myself, oh, I'll have a little bit once in a while, because that becomes all the time, right?
Yeah.
I just have a clear line. I just don't eat that stuff. And in my previous job, it got to be kind of a joke, because people start to tease me a little bit, but I think they actually had a lot of respect for me eventually, because I
Yeah.
was steady and steadfast that no, I'm not eating what I can consider to be, junk food or animal-based products. And then what happens is, then people start to come in your office and they start to question you, like, how do I get started on this or whatever,
Yeah.
and I think that you actually have a lot of influence by just being sort of steadfast and consistent. Uh,
Absolutely.
yeah,
Absolutely. And I think it really, because if anything, if we can be, that you can say, I am enjoying this, and you
yeah,
can literally say that I am enjoying this, because I don't enjoy feeling sick. I don't
mhm,
enjoy feeling the sickness that comes along with eating highly processed foods or high sugar foods or high fatty foods. And especially now, if you ever go out to dinner or you have something that's like really salty and oily, might be, sometimes you'll go and that's the only option that they have. And it's, you try to choose the best thing. And that what you feel, especially when you've been eating this way for so long, it's a punishment. It's not a reward.
yeah.
And that to constantly reinforce that, and then people want to participate with you, and they want to get on what you're on, and to recognize, it's not fun to go too far and to get into that place. So that's fantastic.
Yeah, yeah. Well, one thing that I mentioned to people is that if they're moving in this direction, that there's an adaptation period where at first the food might taste kind of bland, but then
Mhm.
as time goes on, your taste buds just get more and more sensitive. And it's like you're capable of experiencing this wider array of tastes more than you ever could before. And
Yeah.
so the net effect actually is that you'll enjoy your food even more.
Yeah.
You know,
Yeah, absolutely. And because when we are so bombarded by salt, oil, and sugar and everything that we eat, then when we don't eat it, I remember I used to work in the medical system in Chattanooga, Tennessee, and so most of my patients were kind of underserved patients, and really coming from a place in general in the South, the standard American diet is good compared to the Southeastern American diet, and so it's really a whole lot of fried chicken and sweet tea, and I had to retrain myself after coming back to Chattanooga from California. Oh yeah, it's all about how many cups of sugar you're putting in your gallon of sweet tea, like, and
mhm,
and what you're cooking. Are you cooking with lard? And I forgot.
mhm.
I just forgot that these things were there. And so it is really fascinating to, when you clear that out. And I had patients that would say, oh, I can't drink water. You know, how many patients I hear can't drink water? And they were drinking, like, I had a patient drinking 13 Mountain Dews a day. And he said they were diet Mountain Dews, and his endocrinologist said it wouldn't mess up his sugar. Thought, because his taste buds for those artificial sugars too, they're so much sweeter than even sugar. So regular Mountain Dew wasn't sweet enough for it. I mean, it's just so bizarre when you look at it in that context of how skewed our taste buds can get, and how when we retrain them, we are really getting this opportunity to explore these powerful, explosive, incredible flavors of what true food tastes like. And it's just, it's a discovery, and it's amazing.
Oh, here's a question I've been meaning to ask you is, now when you started on the plant-based thing, were you working like a typical sort of insurance-based, 10-minute visit model? And if so, like, how did you integrate the plant-based thing, the lifestyle thing into your visits?
Yeah, man, I was late all the time. I mean, but I'd have patients that would come. I mean, I had, I was in Chattanooga, and I had patients that were driving from Nashville and from Murfreesboro and various places because they wanted someone to help with this, but they were also coming. They were, sadly, they were waiting in the office. If I was 45 minutes late, I was really running late, because I would really try to integrate it into the visits, despite the fact that, as you know, the medical system it's about reimbursement. It's about how complex are your patients and how many are you seeing. It's not about outcomes, and it's not about care or patient satisfaction. And so they would come and they would wait because they knew what they were getting, and they knew that I would spend the time with them to give them what they need. But it was so difficult, and it was really challenging for my own well-being. I wasn't coming, I was, by the time I finished my notes, I hardly ever saw my kids. I was, I had one break in the day, if at all, to do all the things. I had 3 babies during this time. And so I would have like 10 minutes to pump, to pee, and to eat.
Mhm.
And then just stay there for, and then not come home until 8 at night. And it was really tragic. And so it was great when I met my health coach and we started doing group visits. And that's
Mhm.
how we did that. We were kind of the first people to do that in this area. But still, there was so much adaptation of the group visit to be covered under insurance that we ended up kind of saying, well, why are we trying to adapt a great program to fit a broken model so
Mhm.
that we can get reimbursed through insurance? And that's really what made me kind of step out of the insurance model. But yeah, it was very difficult, particularly because most medical practices aren't set up with a health coach. And certainly if they do have access to a registered dietitian, I would find that if I would send them to the registered dietitian, he or she would be telling them to eat low-fat dairy, and just basing this on recommendations that were so outdated and are not going to get them where they need to go,
Mhm.
if they really want to fight their disease or improve their diabetes or whatever it was. So it was a frustrating experience for sure, but I'm
Yeah.
glad I had it.
Yeah. Yeah. Now, so do you exclusively do the Love.Life telehealth now?
No, so I do that. So I see patients in 7 states through Love.Life, which is, I love that team. It's so fantastic, and having these incredible doctors to bounce things off of, and it's just, I'm so happy to be on that team. But I also have my own practice here in Chattanooga, which is just me and my health coach, who's a Food for Life instructor and a nurse, and we worked together and did the group visits together in the medical system here. And then we kind of took that and we work a lot in doing community projects and education. And she does an incredible Food RX class that's based on the work of Neil Bernard and PCRM, and it's been consistently, and it's offered for free here in Chattanooga, and it's housed at a hospital, and so that's been a great thing to just really increase awareness, particularly here in the South, of what the power of a plant-based nutrition can do. So that's what we do here. And I see patients through my own practice here locally in Chattanooga. I'll see them there, but most of the patients that I see are through Love.Life Telehealth. And then I work a lot in employee health and wellness, try to educate it really employees that are already in a community on the power of lifestyle medicine. And I think that's where my gifts kind of lend most effectively, is creating positive change in a community, and to really recognize what we can do if we come together and make it fun and bring people together around these positive change. It's so much easier than trying to swim upstream and live a healthy life when everybody in your workplace or everybody in your community or your church or your wherever you are is doing something different. It's a lot harder if we're isolated in the journey. So
Yeah, I think one of the challenges in this whole thing is that really for people to eat sort of a healthy, whole food, plant-based diet, it very much goes against the culture. You know,
yeah.
Hospitals are supposed to be institutions promoting health, but there's, sometimes they're the worst as far as promoting bad health.
Yeah.
Ice cream socials when somebody retires. I mean,
Yeah.
there's always cake. There's always an occasion for cake and cookies and pizza and that sort of thing. And I think it sends a really bad message, actually. It normalizes this behavior that makes people sick. And yet I really think that hospitals should be the ones like leading the charge on this.
Yeah.
So
Which is what they're doing in New York. I don't know if you're familiar with that, with Michelle McMacken and the mayor of New York City, and they're making plant-based nutrition the primary default meal throughout all the major hospitals in New York City, which is,
oh yeah, I think I did hear something about that. I mean, that's
yeah.
a major step forward.
Oh yeah, and unusual.
Yeah.
Certainly.
Yeah, I mean, if a big place like New York can start doing that, and hopefully it'll start to become more normalized, rather than just sort of this kooky fringe thing.
Yeah.
But now when you see, I'm curious, like, when you have somebody come in, let's say they're diabetic or hypertensive, do you make any changes to their medications right away, or do you just follow them and see what happens? Because, my understanding is that if they're on hypoglycemic agents, they can actually bottom out their blood sugar.
Absolutely. Absolutely. So it kind of depends on where they are in the process, what their sugars are running when they come in, and how extreme they're going to go in terms of their dietary changes. So monitoring is really key. So I try to get everybody, particularly that's new if they're doing some major changes and they're diabetic per se, then trying to get them at least the free 2-week trial of the continuous glucose monitor, so that they can really be actively looking for, are you bottoming out? When do we need to reduce your medications, et cetera? And that's kind of person dependent, certainly, as to where they are and how extreme that they're going. And with blood pressure, the same. I just make sure that they're checking it. A lot of patients are not checking it regularly. So I just make sure that they are, and I always kind of give recommendations. If your sugars are this, if your blood pressure is this, then you'll want to cut down, and I look at their medication list and kind of see, this is the first one that I would reduce. I would kind of prioritize which meds we get off first, which ones might be the most dangerous in terms of contributing to hypoglycemia if they're diabetic. Like I would probably leave metformin, which doesn't cause hypoglycemia, for a minute until we're really stable. But if they're on insulin or on other agents that will drop their sugars low, then I would speak to those and give them some kind of parameter from day one, so that they know what the risks are, what the symptoms are, and that they're monitoring those and they know what to do. And then I usually, if they're doing something extreme, I would have a pretty soon follow-up to make sure that we're following that closely. And the same with blood pressure. So generally I'm saying, okay, if you're, less than 115 or consistently less than 120s, or you ever have, lightheadedness or orthostatic symptoms, like you're being overtreated, then this is the medication. I look at which ones they're on, and I would cut this one in half first and continuing to monitor. And if you continue to go down, then this is the approach that I would give them. So I usually give them a stepwise approach, just so that they know what they're looking for, what the dangers are, and what they should do about it. And then also have hopefully a pretty soon follow-up, depending on how, the picture.
So your telehealth patients are going to be sort of a self-selected group that are already interested in plant-based nutrition, but your other patients are not necessarily. Is that correct?
Well, my practice in Chattanooga is very, it is only lifestyle medicine. So I'm not
Okay.
doing primary care. Some of the patients I have there were my primary care patients before.
Mm.
But I really kind of work with the bad business model of I don't want to see you forever.
Mhm, mhm,
I
mhm.
really want to partner with you where you are, give you the skills that you need. I've got this amazing health coach that can help reduce all the barriers so that if we work together 3 months, 6 months, then my goal is that maybe you want to check in,
Mhm.
when you need me, but you have the tools that you need, you know your body, you know what you can do, and you go from there. And, everybody's different. I think that, some people will come in knowing that's what they want and they just need a little bit of hand holding. Other people come in and they think that they can do this and then life happens and then they come back a year later and they haven't done any, it's variable just based on people's readiness and also people's community and the support that they have to do it. And also, and sadly, that is a barrier because I don't work in the insurance model. And certainly, particularly with COVID and financial stress is a real thing.
Mhm.
And when people are so often paying so much money for insurance as it is, and they're not getting this from their health insurance, but the first thing that's going to go is often, this kind of support, which in the long run, people weigh that differently. And I have so many patients that are like, well, if I could not be on all these medications, then my medical bills are going to be so much less and it's worth the investment.
Right.
But then, people look at things in different ways. And so it's just meeting patients where they are and trying not to be critical, but being compassionate to wherever they are in their journey and trying to be the best partner for what they need at that time for what they're ready to do. And
Mhm.
then sometimes they'll really get to, I have patients where I'll see them, they'll get off their blood pressure medicines, they're doing really well, and then I won't hear from them for a long time, and then something else will come up, or they'll say, I'm ready to take this a next step, and then they'll come back, and so it is kind of a fun journey to see just what the need is at that time and how you can best help them.
So what sort of strategies, I mean, I think a lot of people, they've never heard of plant-based, it's completely foreign. What sort of things do you tell them or suggest to them to try to introduce the idea to them and sort of move them in that direction?
Yeah, as in resources.
Or it's like, just how does the conversation go? I mean, somebody comes in with high blood pressure or high cholesterol or whatever the health problem may be, and you think it's something that's amenable to plant-based nutrition. How do you sort of open up that conversation and start to plant that seed in their head if they know
Yeah,
nothing about it?
well, how I do it now, which is not how I didn't really have the capability to do this when I was in the medical system, but generally I have them fill out at least a 1 day, but ideally a 3 day diet log. And that's the easiest way I find to just, if I look at it and I'm like, okay, you're eating this for breakfast, this for, so say I notice that they're not getting any fiber. They're eating 2 eggs for breakfast. And I see that all the time. They're trying to be healthy. So they eat 2 eggs for breakfast and no bread, and so I just say, okay, well, what could we put here? What is an option that you could eat, and I try to give them feasible ways to either, depending on if they're really what they're up for. And we actually have a handout that we made, my health coach and I, which is kind of fun. It's like, okay, we've got 3 different people. We've got I'll do whatever you say, let me know and give me the recipes. Okay, then that's you, right? And then in the second column is, I don't have a lot of time, but I'd like to do something, and so, and the third one is, I'm not going to do all that, but how can I up my fiber and just increase what I'm doing, and so it just is kind of serves people where they are. And so, all right, well, how about we add some fruit or some greens to your breakfast, or, what can we do there? Or I look at what they're having for lunch. So they're having a sandwich and chips, right? So then I say, okay, well, if maybe, and I look at, are they buying it out or are they bringing it, because to try to fit in their parameters. And if it's a local patient, then I know where they're eating and I know what else is available. Okay, well, at this place they have that. Would you order that? Or how about instead of the side of chips, you have a side salad, or, how could you have hummus instead of ham, and just try to make reasonable things that they, and sometimes I've never heard of hummus, or, so you have to just meet them where they are. And I try to just see what they're eating and let's make a goal for, and so what I generally try to do is, all right, if we could add some greens to your dinner, some beans to your lunch and some fruit to your breakfast, then we're good, and I try to put ground flax in there somewhere, and so if that's the first thing that they do and that's all they do, and it fits pretty easily with the meal that they're already eating and they don't feel overwhelmed, then they do that and they come back, and then we just try to make realistic goals like that. So sometimes I'll approach it like that. Just kind of depends on the person.
If somebody is eating entirely plant-based diet, are there any nutrients that you recommend they take in the supplement form?
Yeah, for sure. So B12, I recommend B12 for everyone. It's very low risk, but I think it's high yield. And while, yes, of course, you can get it supplemented through nutritional yeast and through other fortified foods, that's just a pretty slam dunk. And again, a lot of people that I see will be on metformin, which drives down your B12. They often are on Prilosec or some kind of proton pump inhibitor for acid reflux, and that will drive down your B12 and do some other things as well. So a lot of the people that come in are already on B12 for various reasons, and that's not a far cry. Personally, what I look at for nutrients, I look at for everybody that's on a whole food plant-based diet, and I look at their B12. I usually recommend supplementation. Vitamin D3, which is really not whole food plant-based specific. That's really everyone. It's hard to get that through your food. So I will at least look at a level or suggest vitamin D3 with a meal. I do, and I know this is more controversial, but I look at omega-3s and usually recommend algae omega-3, and then the data is not as strong as on that. And again, it's going to be really important we get out your processed foods, right? So the omega-3 supplement in itself is not going to fix your inflammation, but the removal of the processed foods and omega-6s and increase of the omega-3s and really getting ground flax as part of your nutrition as well. But I do generally recommend a supplement of algae-based omega-3. And then I just talk to them about iodine sources.
Mm-hmm.
If they're not eating fish, then, 150 micrograms of iodine, whether they get a little bit of iodized salt, which is about a little more than a half a teaspoon of salt a day in their diet. And so it's not very much, but a lot of people are on Himalayan salt that doesn't have iodine in it. And so I ask them, are you having regular seaweed? And it's hard to judge how much you're getting, but if there's not an iodine source, then I just make sure that they're aware of the need for iodine and figure out a plan for how they get that. But those are the four that I really look at, or at least discuss. And if not supplement, then at least monitor their levels.
Mm-hmm, mm-hmm. Yeah, I've been back and forth on the omega-3 supplementation, but I've come to the conclusion I think it's probably a good idea. My understanding is that, there's evidence like early in life, it's very, very beneficial. Late in life, it's very beneficial. The data is not strong enough in sort of midlife, but the Surzais, whom I'm sure you're aware of, their suspicion is that you might be undermining yourself through midlife if you're not taking it, and then it becomes manifest, when you get older. And by older, they mean like 65 and older, and I'm 65 in like 6 months. So we've started taking the algae-based omega-3.
Yeah.
Well, anyways, that has been excellent. I want to be respectful of your time. We've been talking for quite a while.
Well, this has been so fun. I'm so glad to get to know you.
Yeah. Hopefully we can do it again sometime, and we'll stay in touch.
Absolutely. Yes. Well, thank you so much. And definitely don't hesitate to reach out. I look forward to talking to you more down the road.
I really enjoyed the conversation with Dr. Bozzone. We need more doctors like her that are integrating lifestyle medicine and plant-based nutrition into day-to-day practice, addressing root causes of illness rather than just medicating symptoms. If you think that you might like to consult with Dr. Bozzone, check out Love.Life Telehealth. If she happens to not be licensed in your state, they have a number of other like-minded physicians licensed across the country. Joyce and I are trying to grow the channel. Please like and subscribe to help us reach more people about plant-based nutrition and lifestyle issues for better health. Also, please comment below. We look forward to the feedback.